Well, fears of looming harsher lockdown measures have been rising following the emergence of the Omicron variant. The Omicron variant was first discovered in South Africa and has since been detected in Belgium, Botswana, Israel and Hong Kong, among others. Now, let's discuss this variant further. We are joined via Skype by Dr Angelique Coetzee, Chair of the South African Medical Association. Dr Coetzee, always a pleasure. Thank you so much for joining us this afternoon.
Thank you so much, and a good afternoon to all your viewers out there.
Now, Dr Coetzee, as we wait for the President's address tonight, should we be expecting tighter lockdown measures? I mean, I'm sure you've seen just a frenzy around this announcement of this new variant.
I know it's speculation at this current stage, but from SAMA's side, I think the only stricter restriction that we would be adhering or that we would acknowledge would be that big gatherings being stopped. We know, with the international borders closing up for South Africa, we are again going into a very, very bad economical downwards spiral. There's no sense in any case to close borders, provincial borders. That's not going to help us at this current stage anymore. I think the best that we can do is, again, as I have said, the restriction on big social gatherings out there, get people to vaccinate themselves, get people to please wear their masks and social distancing, that we call it the non-pharmaceutical interventions, which we have now said how many times the past year and a half to everyone out there that would like to listen. So if you can do all of that, as well as get yourself vaccinated, the chances that you would then get severe disease at this stage are greatly diminished. Yes, it's true, we do not know the severity of the disease going forward. But what we have seen currently, and this is not anecdotal, this is the clinical picture, not only seen by me, but by other family practitioners in the Gauteng region, is that most of these cases are mild, whether you're vaccinated or not. And yes, we did see, or do see, vaccinations, people who that had been vaccinated with breakthrough infections. Again, mild disease. There is no increase in our hospital admissions currently, not in the private sector and not in the public sector. Those admissions that are seen are easily being treated and handled in the ICU. I know of one patient being ventilated in one of the Pretoria hospitals. Again, we're not sure whether it's Omicron or Delta variant. For now, there's no reason for panic. 2 weeks from now on, we might say something different, but we urge patients and people out there, please get yourself vaccinated and listen and do the right thing and stop going to big gatherings, social gatherings especially. That would be the advice.
Now, I was speaking to Professor Ramnik Aluwalia earlier, and of course he's agreeing with you in terms of the vaccination part, but he did paint a rather alarming and a gloomy picture, essentially about, how unvaccinated people are a mixed breeding hub, basically, of these mutations that we continuously keep seeing now. I know that you said we don't know a lot about this variant, and we should get an indication, just around 2 weeks from now, just about what it actually entails. But for now, how concerned should South Africans be, particularly those that are not vaccinated?
Well, if you're not vaccinated, you should be worried, especially if you are above the age of 50 with comorbidities, with chronic diseases. We have said this many times. It's not a new thing. So we also said in the past that people who will where the variants would most probably originate from will be people with severe immune diseases. That is stuff like HIV, people suffering from HIV, and controlled, not treated optimally. That will be the patients. Also not vaccinated. So there's a saying that says, we are not safe until everyone is being vaccinated. So Africa and South Africa's got a high burden of HIV patients. We also saw that a lot of these patients didn't attend clinics during the last 3 or the previous 3 waves, again, leading to them not compliable with their medication. And that will lead to variants with a lot of mutations going forward. So what is the answer? Get Africa vaccinated, and our own country, let's get people vaccinated, get people with chronic diseases, especially immune diseases, go and get yourself on medication and take your medication on a daily basis and wear your masks, the non-pharmaceutical interventions. These are the stuff that you can do. It's not going to cost you an arm and a leg to do and adhere to these interventions. That will be what's saving your life in the end of the day.
Now, if we begin to interrogate those numbers, Dr. Coetzee, the NICD saying of the 35,000 tests done in the last 24 hours, 3,220 were positive. But then you start looking at the positivity rate, and it's at 9.2%. Help us make sense, because we know that we've been told continuously by the World Health Organization that that positivity rate needs to be under 5% for the pandemic to be considered under control. You saying we shouldn't panic just yet. We are not in a crisis. Help us unpack these numbers and what they mean.
Yeah, great question. So first of all, it is true. You want it under 5%. We are past that, and we are for the last 2 days between 9.1 and 9.2%. But you also need to look at what you are clinically experienced. You look at the clinical picture. So let's say we have seen, and we know that the past 24 hours, 2,264 people in Gauteng tested positive. Let's say only a third of those patients was severely ill and been admitted to hospital. I would have said today to you, we are in trouble. We need to make a plan, and urgently we need to look at strict lockdowns. But we're not there. Although we are 9.2%, and yes, I'm quite sure it's going to go up, but as long as we are seeing mild clinical pictures of patients which we can easily treat at home without a lot of complications, without adding any burden to our healthcare system, as it's currently the situation, we will say there is no reason to panic. Do the right thing. That's again, the vaccinations, the non-pharmaceutical interventions that you need to take, and stay away from big gatherings, big social gatherings. And those parents that doesn't want their children to be vaccinated, that's above the age of 12, make sure you know where your child is going. Otherwise, that child of yours is going to get COVID-19, maybe the Omicron, bring it back home, and you yourself that's also not vaccinated with high blood pressure or diabetes or any other disease might then get severe disease going forward. We cannot tell you, we cannot say to you, you will be safe. We can, however, say to the people who's been vaccinated, and with the breakthrough infections that we have seen so far, which is mild, you will be okay. Again, the EVDS system, our vaccine system, is linked with our NICD system. So within a week or two from now on, we will know how many people that's been vaccinated is either suffering from severe disease, because they will be admitted in the hospital, of which we haven't seen an increase. We're not saying there's no patients admitted. We only say there's no dramatically increase. 1 or 2 patients being admitted on a daily basis is not a lot of patients. So if we can figure that out by being vaccinated, that you're not going to get that severe disease, that we still stay with the same mantra that we have said, vaccines prevent you from getting into a hospital, you can stick with that, then we have no reason to panic as long as it's mild disease and people listen and do what is the right thing to do.
In anticipation of what the president is likely to say tonight, I mean, we've been on this journey as South Africans and the rest of the world for that matter for almost 2 years, where we've seen lockdown restrictions just not speaking to the kind of numbers that we are seeing currently now. You saying avoid large gatherings. I mean, what's the likelihood that that entails closing or stopping intra-provincial travel, that we're likely to see closing of restaurants or restricting movements at restaurants as well? I mean, are we likely to see, again, just that restrictions imposed where you are saying that the numbers are not that high, that in fact mild clinical picture is currently displaying itself?
Yeah, again, from SAMA's side, we would suspect or expect the minister and the president to announce tonight stricter restrictions on social gatherings. For now, we do not foresee any interprovincial travel restrictions. We do not see that would be on the table. But it is up to the people out there. It's up to the people of South Africa what type of restrictions they are going to get going forward. Because how many times do we need to say the same thing? Go and get yourself vaccinated, do the NPIs, and keep safe. So if you can do this, if the South Africans can just do this in the townships everywhere, I think that we will stay where we are, with only restrictions on social gatherings.
Dr. Coetzee, do you support mandatory vaccinations? I mean, we're hearing already 3 universities in South Africa already issuing out statements that, students that are not vaccinated by February of 2022 may not return back to campus. Do you support that?
So my personal opinion is anyone who works with people or are part of a group of people need to be vaccinated. You've got a responsibility towards yourself. You've got a responsibility towards the people close to you and in your direct vicinity. So whether you are a student working with other people, whether you are a doctor working with patients, whether you are a salesman working every day with people coming into indirect contact, that's the type of people that must get vaccinated.
Dr. Coetzee, thank you so much for speaking to us this afternoon. Always a pleasure having you on the show.